Hi, good evening. Austin Mayor Steve Adler, you got a second? Actually, you got a minute? We're going to go through. I get enough grief for saying you got a minute and then going more than a minute. All we have to do is now start counting seconds. Welcome back. We're going to go over the virus numbers. UT model looks pretty alarming. Dr. Escott was in the news today talking about what stage 5 red might look like. So we'll talk about that a little too. But let's begin by looking at the numbers so that you can see what we're dealing with. This is the main dashboard we always take a look at. We look at the number of new hospitalizations today. It's 52. That takes our 7-day running average up to 43. Look at that chart in the middle with the color-coded. We were down at 11 for the first week or so of November. I think we got to the second or third week, we were in the yellow zone. And then just before Thanksgiving, we moved up into the orange zone. And that's where we've been. We kind of bounced around low in the orange zone, and now we're moving up toward the red zone. The red zone starts at 50, so getting up to 43 is beginning to get us up there closer. That's 50 on a 7-day running average. So even though we have 52 admissions yesterday, until that becomes our 7-day running average, the number will be something less than that. Here it is 43. Number of new cases today, 382. That compares to the 7-day moving average of 334. Recall that yesterday we had a city council meeting, so we didn't get a chance to talk last night on Got a Minute. But yesterday, 427 cases had been reported. So we're down on cases versus yesterday, up on the 7-day moving average. What we still don't know is that how long this spike that we're looking at is going to last and how great it's going to get. What we can tell is that about a week and a half ago, pretty much on Thanksgiving, we had more people have physical interactions without social distancing and without wearing masks. That's why you see the numbers start going up at this point. That's why we're above 52. And you can look back at the time on Thanksgiving. That's what worries people about the Christmas holidays coming up. By the way, happy Hanukkah. But if we have those same kind of gatherings, then we have a spike on top of a spike, and then we're in real trouble. The numbers in green are the 7-day moving averages for hospitalizations, ICUs, and ventilators. Let's take a look at the actual census numbers on the other chart and other dashboard on the city of Austin. You can see that the 7-day moving average for hospitalizations is 252. But at the same time, the number of people that we actually have hospitalized tonight is 272. So we're above the 7-day moving average. It's interesting to note that yesterday there were 280 in our hospitals. So we're down from where we were yesterday, but still up from the 7-day average. We saw the same kind of pattern with cases. You get a kind of an ambiguous tell. Numbers are going up, but they went down from yesterday, but still above the 7-day moving average. But the next number is the one that concerns me. It's the number of people in our ICUs, our intensive care units. We know that if our hospitals get overwhelmed, that's the number that we're going to have trouble with, because we know that we only have the staff to really be able to take about 200 COVID patients into our intensive care unit. That's maintaining enough extra space for people who have heart attacks or involved in car accidents. If we get above 200 people in our ICUs with COVID, then we're going to start having to make decisions that are not motivated by the best care possible that we can give. And that's what we need to be able to avoid. If we get above 200, then we can't provide probably the care that we should for someone who has a heart attack. That is our early indicator number. We need to look at that. 200 is our limit. 90 is the number we have in our ICUs tonight. You know how many people we had in our ICUs last night? 79. So we've gone from 79 to 90 in one night. Now that number bounces around. I suspect that tomorrow the number may come back a little bit. I don't think we're going to see another increase of 11. But that's the concern and the number we need to watch. Add the number of new cases. We're almost at 42,000, not quite. The number of people who have passed away is 504. That's one more than yesterday. Two more than yesterday, rather. But the last time we were together on God a Minute, we were below 500. So we really need to take a moment to just recognize that we have now gotten over 500 people in our community that have passed away because of COVID. You know, we get up to like 517, somewhere in that range, and COVID then becomes the third leading cause of death in Austin, Travis County. This is a serious, serious deal. But we're continuing to watch the numbers to see what it is that we need to do. We set those triggers, those indicators at a low enough level so that we could change behaviors and stop our hospitals from getting overwhelmed. Because once the number starts going up, it can accelerate. So let's take a look at the University of Texas chart that we have, which will show us what the modeler at the University of Texas says the model may happen based on the numbers that we have. Why don't you take me out of the screen, Janine? So let's make that chart as big as we can for people looking at it. The R factor in the upper left-hand corner. Remember, if it's below 1, that means the virus is going down. If it's above 1, it's going up. There was a period of time just a couple months ago when we were down at a number that was less than 1, like 0.58, I think. We got to 0.6. We spent a lot of time around 0.8, 0.9 today, 1.42. The possibility the epidemic is growing is almost 60%. We have 28 more infections out of the community than we had just 2 weeks ago. But look at that chart. The dots are the experience that we actually have. The green line is the 7-day moving average. And when you look to the right, that kind of aqua line, while you look at all that spaghetti, those are all the different possibilities of what could happen in our future. Each one of those spaghetti lines has an equal chance of happening. But you can do a mean line based on all the possibilities. And that's what that aquamarine line is. And look how it is heading north. It is almost vertical. That's the number that concerns us right now. A few days ago, it looks like we might be getting to a stage 5 number somewhere between Christmas and New Year's. Now it's looking like if we continued with the existing trend, we could be at that number next week. Of course, we don't know. We'll watch it here over the weekend. We'll have a better idea on Monday what it is that we're looking at. But this is the chart that's causing right now the healthcare professionals, Dr. Escott, the greatest amount of concern. Well, what does it mean if we pass into the red zone, if he calls us into that stage 5 area? Now, it's just not crossing into 50 as a 7-day running average that automatically moves us into that area. That's certainly the lead indicator that was on that color chart. When we got to 50, that means we had to start seriously thinking about calling for red zone behaviors. He looks at other things too. He looks at the rate of increase. If you're entering into the red zone at a flatter rate or a more vertical rate, that impacts how much time you have to be able to make adjustments so that your ICUs don't get overwhelmed. It's interesting, the last time we were in this stage over the summer when we came close to our hospitals being overwhelmed, but for the behavior that we did as a community, it took us 38 days to go from 20 to 40 in a 7-day moving average. Let me back up. It took us 10 days in our first surge to go from 20 to 40. It took us only 10 days. This time it's taken us 38 days to cover that same thing. So we were able, we went up really fast in that 10-day period of time back in our earlier first surge. Where we are today it's 38 days. So it's a flatter line than it used to be. What that means is that maybe there's a little bit more forgiveness. You can come out of that chart if you want to. It's a little bit more forgiveness than we had anticipated that we might have before. And that's the kind of thing that Dr. Escott takes a look at when he's trying to decide whether we go into stage 5. What happens if we go into stage 5? What kinds of things do we do then? Let me go back to the risk chart, because I think that some of you are coming in and want to see those risk levels. Why don't you just go to the risk level chart? Why don't you take me out of it so that people can make the chart bigger, Janine, so that people can see it? Up until the second week in November, we were in that risk level yellow, stage 3. The number 7-day moving average was somewhere between 10 and 29. We had gotten down to 12, and then the numbers started going up. We moved into the orange zone, I think about November 19th, thereabouts, I think is when we moved into the orange zone. And we moved into the orange zone, the kind of rules change. When we move into the orange zone, what changes is we're asking people to further limit their social and other groups to be under 10 if you can. In the orange zone, we're asking people not to engage in non-essential travel when we go. So as of November 19th, we're asking the community not to engage in non-essential travel. But that puts us in that orange zone. That's the area more than 30 hospitalizations on a 7-day moving average. But we move into the red zone somewhere between 50 and 90. And where we are when we move between 50 and 90 is a call determination that Dr. Escott makes, as I talked about a second ago, looking at other factors like mobility numbers, looking at the rise and how sharp the incline is. I'll be looking at other factors. But if we move from orange to red, then we have to talk about further behavior changes. Well, what are the behavioral changes that we're talking about? Now you can come out of that chart, Janine. The kinds of things that Dr. Escott is talking about is moving to the place maybe where we go back to where we were with restaurants, where we just pick up meals, or we get meals that are delivered. We shop curbside rather than going into stores, except for essential stores like grocery stores or pharmacies or that kind of thing. One of the things to consider that other cities have done is to actually do a curfew. El Paso's done that. The Valley's done that. San Antonio's done that. That's something that's being looked at. There have been no plans made, no decisions made. We're still looking at other cities to see what other cities have done. Some cities have focused on social contact, so really only trying to limit social engagements in the evening. Not really talking anything that would interrupt essential businesses or people having to shop for their families. But where we're seeing infections are where people are getting together with their families and their friends in the evening. For some reason, people wear their masks when they're around strangers, but when they're around their extended family or their extended friends, they don't put on the mask. Because they figure, hey, I know this person, I can't get the virus from them. And it does not work that way. Your friends or your family just as likely to carry the virus as anybody else. And it could be that they're carrying the virus and they don't even know. If you are around anybody not in your home that you're living with, you should be wearing the masks. So a curfew that would be set at 10 or 10:30 is just a way of getting people not to be socially engaged as much as they might otherwise be in the evening. You get the question of how it is that you possibly can enforce something like that, and the answer is really difficult to do that. We're trying to enforce, and we'll enforce the rules we have as best we can, but there are not enough code enforcement agents and firefighters and deputy sheriffs and police officers to enforce our way to compliance. Any rule we have has to be something that the community wants to do, enough to expect it of themselves and to expect it of one another, to expect people to engage in those behaviors, because that's the best way to protect their family, and for us to help protect their family, and for them to help protect my family. And we're all out trying to protect everybody's grandparents and the like. So if we did a curfew like that, it would be in part to see and give the community the message that we're really serious about this now, that the numbers seem to be increasing like on that UT model. And we're going to see if the actual numbers start hitting in that same kind of way. There will always be the recommendation to avoid really big groups, no matter where they are, even if it's a group that the governor's allowed. So people will be encouraged to participate more in religious services virtually rather than doing it in person, and that kind of behavior. So we're going to consider that. We'll be talking about that next week. No decision made as of yet. We're going to continue to take a look at the numbers. The vaccine just around the corner. If it has not been approved at this point for distribution, we are probably hours away from that happening, which means that the virus, which is all loaded and ready to ship, will get shipped. I would anticipate we would get our first supply next week in our city. It's going to be given first to healthcare professionals that are working with patients who are sick, because those healthcare professionals are the ones that we most need to protect. And then the rollout in terms of who gets it are the people that we most need to protect because they're dealing with the sickest people. And then we're going to give it to the people that, if they get it, are most at risk of suffering serious consequences. So you give it to the elderly that are living in nursing homes. That community represents a huge proportion of the number of people that have passed away in our community. So you want to make sure that you get them the virus, first responders and the like. And then you work your way back to essential workers or people over 65 or people with diabetes. The hope is that if the virus can keep coming, maybe most everybody who wants to have it will have had that chance by late spring, early summer. But let's see how that gets laid out. Let's keep our fingers crossed for the virus to come quickly. Let's continue to watch the numbers and hope that they don't go up as the models indicate that they would. Let's get ready and start thinking about extra steps that we might need to take. We'll know more next week. Next week on Tuesday is election day. If you have not early voted, you need to make sure that you vote next Tuesday. Runoff election, which means that in the general election, there was no candidate that got 50% of the votes. We have a city council runoff in District 6. Incumbent council member Jimmy Flanagan has an opponent running against him. City Council District 10, council member Allison Alter has an opponent running against her. AISD District 5, Lynn Boswell and Jennifer Littlefield are running against one another. AISD Board District, it's an at-large district, so if you live anywhere in AISD, you get to vote. Norlita Lugo and Leticia Morena Caballero running against each other. If you have not voted early vote, please make sure that you vote on Tuesday. Travis County, there's a website that you can go to find out where the voting election locations are. Also in Williamson County, here's a website where you can find where voting locations are. Let's continue to watch the numbers. Make sure that you vote next week. If you haven't otherwise voted, please wear your mask. Please social distance. Please avoid large groups. Let's do everything we can to avoid having to take real limiting actions. And with that, you all take care. Have a good evening. I'll send out my weekend newsletter tomorrow, and we'll get back together here on Got a Minute on Monday. Have a safe weekend.